Hi. Yes, yes, clearly good. Thank you for introducing me to the general. Hi, I'm DJ Choi from South Korea. I work in the Baran Hospital in Jinju, and I'm prepared the biportal endoscopic spine surgery through a virtual reality system. Thank you for this very big conference and a very big idea for the surgery. First of all, I would like to explain my procedure first. So, can I see my presentation? Would you please enlarge the presentation? PPT 파일 enlargement 하게. 예. Yep. Can you see the PPT present file on your screen? Okay. 네, 그겁니다. 그거. 네. Right. Yeah, can you see the file? Okay, I will start. Yeah, I started this surgery the best by portal endoscopic spine surgery for lumbar spine disease. I am already worked in the spine center for 7 years for only open surgery. But in these days, this new technique was come to our minimal invasive spine surgery. So we can change the world with this technique. So we can decrease the complication and we can access the better benefit to the patient. Next slide, please. Yeah, this is not my opinion. This is the American Orthopedic Spine Surgery doctors present this report. Wide open dissection in spine surgery is not inevitable. It is only surgical trauma in these days. So even in America, they denied the open surgery. Next slide. The open surgery has another complication. It is very, very important. It is through the open wound, the infection comes to the patient inner body, so it is very dangerous. Next slide. So we introduced with the minimal invasive endoscopic surgery with only 2 of 1 centimeter portals, we can handle the whole lumbar spine disease. Next slide. After with a big dissection and instrumentation, the problem is 5 years later, one of your 10 patients have to another big surgery, instrumentation. Next slide. This is one of my patient cases. So after 4-5 level with the big surgery, 5 years later, he got another lumbar problem at the upper level. But 4 years later, he got another disc problem. So after the first surgery, the patient is designated. The patient has to get another surgery 5 years later. So it is the problem in these days. So I changed our concept. Next slide. So we introduced biportal endoscopic spine surgery. Next slide. So with a big, huge disc, in this case, generally, we perform the big open dissection and instrumentation because we have to save the dura or nerve. But in BAS, we can handle the disc without root injury. Next slide. In a very senile patient with age of 81, he is very senile, but we can handle it. With the small bleeding, we can decompress the neural structure and we can solve the patient problem. Next slide, please. In multi-level stenosis, L2, 3, 3, 4, 4, 5, even in this case, without instrumentation, we can solve the lesion focused by each one by one. So we can handle it. Next slide. Extraforaminal disc is covered with the lamina and foramen. So in very previous ago, we have to remove the facet joint and sometimes we need to instrumentation. But in this case, we can approach from the far lateral side and we removed only the disc. Next slide. And it is a very challenging case. In lytic listhesis, every spine surgeon thinks that we should have to fix the level with screw and rod. But in our center, we do not perform like that style. We just remove the hypertrophied ligament and hypertrophied spur, and we preserve the facet joint, and the patient is happy. Next slide, please. Even in the lytic where you can remove and access the supraarticular process, and under it there is a spur, and hypertrophied ligament flavum can be eliminated completely, and we save the root without any instrumentation. Next slide. Next slide. So I summarize my case. Next slide. Next slide. So I think you are boring because we can solve any of the lumbar spine disease can solved with this endoscopic surgery. We did not need anymore the instrumentation. So what is the benefit of the biportal endoscopic spine surgery? First, most of the various lumbar spine diseases can be cured with this endoscopic surgery. And the second is there is no surgical trauma. We preserve the muscles and facet. And the third is only 2 small incisions and we can perform the endoscopic spine surgery. Endoscopic itself means the irrigation surgery, so there is no chance of postoperative infection. And the fourth is no need of instrumentation, and there is no happens of the adjacent segment degeneration because we don't need any instrumentation. So after this operation, the patient did not have to pay more money to their disease. in the medical economical aspect of view, it is very cheaper, safer, and very beneficial to the patient. So I will show you this procedure to you now. Thank you. Yep. Yeah, maybe just from now on, I start my procedure and you can use your VR. May I start? May I start? May I start now? Yeah, okay. I will do, I'm going to do my job. Okay, mask please. I will just cut it to 1 centimeter of 2 holes and make it all and infuse the saline, and then the muscles lifting up and they will give us the working space. And then I think most of you are very unfamiliar and it is very freshman to this surgery. So in my operating room, there are two Pokemons. Please rotate your VR 360 degrees and find the Pokemons. Freer, please. Shaper, please. 케어 준비해주세요. 케어 마칠게요. 케어 please. On. Okay. On. 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 Should I please? Shaper, please. 앞에 좀 닦아주세요. 닦을게요. Clean up, please. Here, please. On. Okay. On. On. Okay. On. 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 Correct. 라이시스가 있네. Punch, please. Shaver, please. 피해주시고 더 플리즈 더로 바꿔주시고 케어 플리즈 on on 더 플리즈 Care, please. Punch two. please. 본학사죠. Thank you. Accurate. Punch. 그래? 한치. 작은 걸로 준비해 주세요. (3mm) 펀치 준비해 주세요. 큐렛. 한치산. 한치산. 3mm. Here, please. Wait. On. 펀치. 그래? 그렇지. Yep. 왕큐레 주세요. 펀치 3 그냥 작은 거 스몰 One. Punch, please. Okay, please. Punch, two. Yeah. Should it? Okay. Punch, two. Okay. Punch, three. Okay. Here. Yeah. 펀치 3 그래? 오케이. 오케이요. 업라이트. 이렇게요. wait. 톡, 넷, 톡, 넷, 톡, 넷. 자, 그래. Root is swollen because of the lysis. Punch. Bite. 그래, 왕. 막시무스. 펀치 2. Okay. Stop. 그래. Okay. Yeah, true. 물 맞아요? 물. 또. 네. 또. 네. Upright, small. Straight, small. 그래? 펀치. Thank you. See you. Thank you. 네. 고맙습니다. 네. 고맙습니다. 고생하셨습니다. 네네. 네. 네. 네, 고맙습니다. See you. 그래. Can you hear me, Pedro, Elsa? Hi. Thank you, Dr. Nam. Yeah. No, the root was very swollen, so I think it's a disc, down migration disc. But in this case, there is no disc. It is a lysis case. Did you see that? Can you see that? This is a lysis. So the DRG was swollen by this instability. So there is no disc in the axilla or under the root is clean. So I think it is root irritation because of the instability with lysis. So I decompress the DRG and I will finish this procedure. 물이 안 들어옵니다. 물 좀 꽉 꽂아주세요. 물 틀어줘야지 또 가야지. 네. There is no disk. There is no disk. 안 그래도 자, 업바이트 작은 거 하나 줘주세요. Is there somebody who watching this video? Yeah, I think at first she suffered from 2 months ago. She suffered from the left side calf pain and claudication and sometimes resting pain in the evening. The MRI shows the DRG was very swollen. So I think that the soft disc is migrated and that looks anyway that maybe looks like a disc, but this is a lysis case, so this irritation with by instability, the DRG was swollen. So I think this big enlarged DRG looks like a disc. So I think there's no disc, and I removed the spur at the first time and remove the surrounding compressing tissues. And this root is movable, and there is under the water there's no disc in the root. So I think I have to close up this procedure. Thank you. Thanks for your watching. See you in the live 360 in later time. Good day. Good luck. Would you please close the broadcasting? Side posterior approach. So this left side is proximal and the right side is distal, and this is the axilla portion. So I think the disc is migrated 15 millimeters, so I think that the disc would be here but there is no disc. The enemy is run away, and I think the root is swollen by the lysis instability. Yeah. So the root. Yeah, this is only the discus patient, so I didn't go. I would not go to the contralateral side. Yeah, this is the midline. Yeah. 물 내 거 주세요. 청소할게요. 네, 물 빼줘요. Yeah. After finishing the procedure, I insert some tube for irrigation. I learned this procedure from Dr. Nam. When I visited your hospital, you use this procedure, so I use this well these days. Good. So cleaning up. Yeah. The root looks good and there's no disc material, so I finished my procedure. Thank you for joining us. Thank you very much. Thank you very much. 네, 끝나겠습니다. 네.